topic of axilla is very important for a medical student from both examination point of view and since it has great clinical significance. The region of axilla is known to the layman as armpit. Axilla is located or is a region that is located between the upper part of the lateral aspect of thoracic wall and humerus, that is upper limb. It is a pyramidal shaped space having an upward directed apex and a downward directed base, and having four walls: medial, lateral, anterior, and posterior walls. For a student of anatomy, the location of axilla, boundaries, contents, and description of those contents is very important, which we shall consider all in this lecture. Starting with the boundaries of the axilla, as we mentioned earlier, it is a pyramidal shaped space with apex directed forwards, and it comes to lie between the clavicle anteriorly, upper border or superior border of scapula posteriorly, and the outer surface of the first rib. The base is formed by skin, fascia, and fat and is directed downwards. The medial wall, as you can see in this diagram, is formed by the upper part of lateral aspect of the thoracic wall along with the muscle, that is serratus anterior. The lateral wall is formed by the upper part of humerus, which includes intertubercular sulcus. The anterior wall is formed, the anterior and posterior walls both are formed by the muscles arising from the pectoral region and the region of back. The anterior wall of the axilla is formed by the muscles forming anterior axillary fold, that is pectoralis major and minor. The posterior wall is formed by the muscles participating to form the posterior axillary fold, and those include from anterior to posterior subscapularis, teres major, and down below latissimus dorsi. The contents of axilla include the axillary artery along with its branches, axillary vein and its tributaries, brachial plexus, which include its cords and branches, loose connective tissue, fat, and in the fat are embedded axillary lymph node groups. This is a diagram showing the dissected upper limb and dissected region of axilla. Here in this diagram, a portion of pectoralis major has been cut, and deep to the pectoralis major, the muscle that is exposed is the pectoralis minor muscle. And you can see that pectoralis minor is arising from its proximal attachment, that is from the chest wall, and going towards its distal attachment, that is towards the scapula. And hence it is crossing the neurovasculature of the axilla anteriorly. So you can see in the region of axilla, deep to the pectoralis minor, this is structure in the red is shown to be the axillary artery. Medial to it in the blue is the axillary vein. And you can see that the axillary artery is surrounded by the cords and branches arising from the brachial plexus. Axillary artery. About an artery, a student must know from where does the artery arise, that is its origin. From which main artery does it arise? The course of an artery, its branches, relations, the structures that surround that artery, and the area supplied by that artery along with its branches, and some clinicals that are related with the given artery. So axillary artery, it is the continuation of subclavian artery. Subclavian becomes axillary artery as soon as it passes under the clavicle at the outer border of the first rib. It runs downward up till the lower border of teres major muscle, where it ends and changes its name to become brachial artery. Because of the crossing of pectoralis minor anteriorly, for descriptive purposes, The axillary artery is divided into three parts. The first part of axillary artery, the one that extends from the outer border of the first rib up till the upper border of pectoralis minor. The second part lies deep to pectoralis minor, and the third part that extends from the lower part of pectoralis minor up till the lower border of teres major muscle. Each of these three parts, they have their own branches. The first part, it is very simple to memorize. The first part gives off one branch, the second part gives off two branches, and third part gives off three branches. The first part gives superior thoracic artery, which supplies the upper intercostal spaces in the thoracic region. The second part gives off two branches, which are named as thoracoacromial artery and lateral thoracic artery. They supply the anterior aspect of the muscles and chest region. The third segment gives off three branches named as subscapular artery, posterior humeral circumflex artery, anterior circumflex humeral artery. Subscapular, the name is indicating, is going to participate in the anastomosis around the scapula by giving off its own branches, namely circumflex scapular and thoracodorsal. The posterior circumflex and anterior humeral circumflex arteries, they surround the surgical neck of the humerus and anastomose with each other around this region. The relations of axillary artery are sometimes asked in the MCQs in the written examination. The first part of axillary artery is related anteriorly, or the structures that lie anterior to first part of axillary artery are pectoralis major, clavipectoral fascia, which is part of deep fascia, and sphalic vein. Posteriorly, the axillary artery's first part is related with the serratus anterior along with its long thoracic nerve and medial cord of brachial plexus. Laterally, the first part is related with the lateral cord and posterior cord of the brachial plexus and medially axillary vein. Second part is related anteriorly to pectoralis major and minor, posteriorly with the subscapularis and posterior cord of brachial plexus, and laterally with the lateral cord of brachial plexus, whereas medially it is related with the medial cord and axillary vein. So you can note down that this second part corresponds in relation to the three cords of brachial plexus. The third part of axillary artery is related anteriorly with the pectoralis major and medial root of the median nerve, posteriorly with the subscapularis, latissimus dorsi, and teres major, laterally with the coracobrachialis, biceps, and humerus, the lateral root of the median nerve and musculocutaneous nerves, and medially it is related with the ulnar nerve, axillary vein, and medial cutaneous nerve of the arm. Moving on to the clinicals of axillary artery. The first part of axillary artery is often clinically associated with the development of aneurysm. What is aneurysm? Aneurysm is the weakening of the wall of a vessel. It is weakened so that in the region of weakness, the wall of artery is dilated into a swelling. So in this diagram, you can see that this is axillary artery. It is arising as a continuation of subclavian artery from the arch of aorta. And when it crosses beneath the clavicle at the outer border of the first rib, it becomes axillary artery. And near its third part, it is showing an aneurysm. Aneurysms are most commonly associated with the first part, but they may also be present in other parts of the axillary artery. So you can see that here the wall of an artery has become dilated because it is weakened in this portion. When the first part of axillary artery develops aneurysm, it may lead to compression of the trunks of brachial plexus, leading to pain and loss of sensation in the skin supplied by the branches from the trunks of brachial plexus. It is most commonly found to develop in the baseball pitchers because those baseball pitchers, they use excessive movement of the arm and also with great force. Pulse of the axillary artery is important for a student. A student of medicine must know how and where to palpate different major arteries on the human body. So, where would a doctor palpate the pulse of axillary artery? You can palpate the axillary artery in the region of axilla, just over the inferior aspect of the lateral wall of axilla. And now we know that the lateral part of axilla, lateral wall of axilla, is formed by the upper part of humerus, including intertubercular sulcus. So the doctor is going to put at least three fingers, index, middle, and ring finger, at the lower part of the lateral wall of the axilla, against by pressing the fingers against the humerus. In certain accidents, axillary artery may get damaged. So, in order to, it is one of the initial steps in the first aid given to the patient of road traffic accidents, that when the axillary artery is damaged in the region of axilla, where would the artery be compressed in order to stop the profuse bleeding from the damaged artery? So one can put pressure on the third part of axillary artery, that is against the humerus, or simply by putting pressure at its origin. Now we know that the axillary artery basically arises as a continuation of subclavian artery under the clavicle. So one can put pressure in the root of the neck. This is the region of the root of the neck from where the sternocleidomastoid muscle arises. Sternocleidomastoid takes attachment from the superior surface of the medial two-thirds of clavicle. So it is this region where the pressure can be put in order to stop the bleeding from the damaged axillary artery. Moving on to the description of axillary vein. Now, a student of anatomy must know these headings related with the vein. That is how a vein is formed or how does it begin, its course, relations. Now, the tributaries. You know that arteries, they give off branches, whereas veins, they receive tributaries. So they receive the blood. And how does the vein end? And what area does it drain? And any important clinicals associated with that vein. So starting with the axillary vein, as we just looked at the axillary artery, it ended at the lower border of teres major. So axillary vein will arise or begin at the lower border of teres major muscle. When the basalic vein, which is one of the superficial veins of the upper limb, combines with the brachial veins, which are the deep veins of the upper limb, and these veins will unite at the lower border of teres major, and this union will lead to the formation of a larger vein known as axillary vein. This axillary vein will extend from the lower border of the teres major, will pass upwards by lying most of its course on the medial side of the axillary artery, running just like axillary artery deep to the pectoralis minor and reaching the outer border of the first rib, where it is going to drain into the subclavian vein. Now, just like axillary artery, because of the presence of the pectoralis minor crossing it anteriorly, the axillary vein is also divided into three parts: first part, second part, and third part. Relations of the axillary vein. The relations of axillary vein are that in most of the course it lies on the medial side of the axillary artery, separated from the third part of axillary artery by intervening ulnar nerve and medial cutaneous nerve of forearm. From the second part of axillary artery, the axillary vein is separated by intervening medial cord of brachial plexus, and with the first part, however, it is closely related by lying on its medial side. The tributaries of axillary vein, they correspond to the branches of the axillary artery And besides those tributaries, it also receives sphalic vein. And itself, it continues a subclavian vein at the outer border of the first rib. This is an original prosected specimen showing the structures in the axilla and their arrangement and relation with each other. The structure in the blue is the axillary vein. And here we have the axillary artery with surrounded by the different cords and branches from the brachial plexus. Here at the lower border of the teres major, you can see the basalic vein, which is the superficial vein of the upper limb that runs on the medial side of the upper limb. Sphalic vein is also another superficial vein of the upper limb that runs along the lateral side of the upper limb. Um, a few clinicals, they are related with the axillary vein, but those clinicals are very important. First of all, if the vein gets damaged, air emboli may be introduced into the veins. And these air emboli, they become clinically significant if they are lodged in the different parts of the lungs, where they can cause, ultimately, they can prove to be fatal for the patient. Role of axillary vein in subclavian vein puncture. In subclavian vein puncture, in certain cases, the subclavian vein, we introduce a catheter that is to be placed within the subclavian vein. But in order to locate the subclavian vein on the patient, the axillary vein becomes very important. Now we all know that the axillary vein at the outer border of the first rib becomes the subclavian vein. So the needle is directed medially to enter the subclavian vein as it crosses the rib. In this diagram, you can see that we are supposed to puncture the subclavian vein, but the patient is basically introducing the needle into the third part of axillary vein. Or the terminal part of the axillary vein. So the star here in the yellow is showing the terminal part of axillary vein. Not the third part, but the terminal part basically. So the needle tip, it proceeds into the lumen of the subclavian vein immediately.